Before searching for the adrenal glands, it is important to remember their location and surrounding anatomical landmarks. The adrenal glands, pictured here in blue, are located in the retroperitoneal space, medial to the cranial pole of their respective kidneys. The left kidney is slightly more caudally located than the right. The glands are in close proximity to aorta and caudal vena cava. With this reconstructed 3D module of an abdominal CT, we realized the challenge to reach the adrenal glands lodged in the retroperitoneal space, as most of the GI tract and the spleen occupy the mid-abdomen. The adrenal glands have variable shape, from peanut shape on the left to arrowhead shape on the right. They have also variable size reported in the literature. For reference, we will use the diameter of the caudal pole reaching up to 7.4 mm in normal dogs. To evaluate the left adrenal gland, the probe is placed along the left abdominal wall with a slight oblique angle, and the cranial pole of the left kidney is centered on the screen. A slight rotation with gentle pressure is applied to locate the aorta on its longitudinal axis. The spleen and bowel segment will be seen in the near field, but the adrenal gland will be visible just ventral to aorta. On each side we see vessels, and as we activate the color flow Doppler, we can see some blood flow in the aorta, as well as the phrenico-abdominal vessel crossing the mid aspect of the gland. We see vessel cranially and caudally to the adrenal gland. The one caudally enters the hilus of the kidney, representing a renal vessel. And cranially, we see part of the cranial mesenteric artery. For the right adrenal, we will perform the same procedure, but this time the probe is placed more cranially in the caudodorsal curve of the rib cage. With the dog on his back, more pressure may be required to see the dorsal vascular landmarks of aorta and caudal vena cava. And frequently the descending duodenum is actually seen in the near field, and the gas in its lumen may interfere. Careful search with slow rotation of the probe is done to find the adrenal gland lodged between aorta and caudal vena cava. We see part of the gland here, and as we spend more time accessing the longitudinal axis of the vessel, we can identify with confidence aorta and caudal vena cava. As you notice on this view, caudal vena cava appears in this case more ventral than aorta. The adrenal gland is seen, especially its caudal pole, as well as part of the phrenico-abdominal vessel, and only part of the cranial pole is visible on this loop.